Welcome back, Straight Talkers. Does your child struggle with big emotions, such as sadness, anxiety, anger, or fear? Or do they have intrusive and sticky thoughts that lead to self-doubt, criticism, and pessimistic thinking? Or do they act without thinking things through and behave impulsively? If any of this sounds familiar, DBT is a form of therapy that you will want to know more about. My favorite form of therapy that I've learned about throughout my training is hands down DBT, which is short for Dialectical Behavior Therapy. This was initially created by Marsha Linehan in the 1980s for adults who have significant difficulties regulating their emotions and their behaviors. Given how beneficial it is, it also started to be used with teens and their families in the 1990s. It has continued to take off over the years and is one of the most effective forms of therapy that I've come across, and I recommend DBT to families on a daily basis because of how life-changing it can be. So what is DBT? It's an effective treatment for people who have difficulty controlling their emotions and their behaviors. It aims to replace problem behaviors with more skillful behaviors, and the skills help people experience a range of emotions without needing to act on those emotions. It teaches skills to help kids navigate relationships with family, those at school, and peers, and the overarching goal of DBT is to help people live a life worth living. So in order to understand DBT, we need to know what dialectical means. Dialectical is when two opposite ideas can be true at the same time, and when considered together, can create a new truth and a new way of viewing the situation. Basically, there's always more than one way to think about a situation. And the way we embrace dialectical thinking is by moving away from an either-or way of thinking, which is a very black and white view of the world, and we start using a both-and way of thinking. So instead of having the mentality of either my belief or your belief is correct, we start approaching the situation with the idea that both my idea and your idea can be correct at the same time. I see that you feel strongly about your idea, and I also feel strongly about my idea. How can we meet in the middle? Another way to look at dialectical thinking is that we want to stop living life using the word but and start living in a life where we're using the word and. My kid is being a pain right now, and I love him more than anything. Instead of having the mentality that we're either good or bad at something, we can recognize that we have strengths in some areas and limitations or struggles in other areas. We're always able to improve. So in DBT, there are 5 different problem areas that we focus on reducing, and each area has its own set of skills and behaviors to help. So what are those problem areas? The first problem area is a reduced awareness and focus. It also includes confusion about oneself. So many kids struggle with being aware of their own emotions, thoughts, and urges in a given moment. Many don't know what exactly is making them upset before they either shut down or lash out. Other kids have difficulty with staying focused and participating fully in their activities. They get stuck thinking about the past or worrying about the future. Some struggle with getting stuck living life in big emotions such as sadness, anxiety, or regret. And this can lead kids to miss out on opportunities to experience joy and happiness. Another area that kids struggle with is figuring out what their goals are in life. They're unsure about who they want to be, what they want out of life, and what their values are. The set of skills that are taught to kids who have difficulties with these problem areas are core mindfulness skills. We want to help increase self-awareness and attentional control. The second problem area is emotional dysregulation. Like we just mentioned, some kids live in a negative emotional state, whether it's depression, anger, anxiety, or fear. Others struggle with fast and intense mood changes, where their emotions can be like a roller coaster throughout the day, constantly changing from being up and down, up and down. And as a parent, you're constantly walking on eggshells around your child because you don't know which version of your child to expect. The set of skills that help with these struggles include emotion regulation skills, and they work to increase positive emotions while reducing negative ones. The third problem area is impulsivity. This includes kids who struggle with blurting out, angry verbal and physical outbursts, substance use, overeating, shopping sprees, sexting, driving recklessly, self-harm, and suicidal behavior. If your child acts without thinking about the consequences of their actions, they are acting impulsively, and distress tolerance skills are the set of skills that target these concerns. The fourth problem area includes interpersonal problems. Areas of difficulty include keeping steady relationships. Some kids struggle with 1 minute loving someone and then the next minute hating them, whether it's a parent, teacher, coach, or friend. Others have a lot of conflict in their relationships, and they're often described as being very chaotic. Other areas include difficulties communicating one's needs or keeping your self-respect. A lot of kids struggle with saying no to people, especially when it comes to giving in to peer pressure. Others find it difficult to ask others for what they want, and this could be asking parents for a later curfew or asking someone at a store for help. Lastly, some kids struggle with chronic feelings of loneliness, which is often a result of them being unable to control their emotions or behaviors, which then impacts the quality of their relationships. All of these struggles are addressed with interpersonal effectiveness skills, which has the goal of improving and maintaining peer and family relationships while also building self-respect. Lastly, the fifth problem area includes teenager and family challenges. Some kids and parents think in extremes. Things are either looked at as being all good or all bad. Or simple problems that pop up throughout the day turn into major catastrophes. Sometimes, children and parents struggle with recognizing another person's viewpoint, while others have difficulty with convincing themselves that their own feelings, thoughts, and actions make sense in a given situation. They're basically unable to self-validate. Lastly, many have trouble with rewarding others, and a common example of this is when parents are uncomfortable giving positive praise when their child does something correctly. They might also struggle with applying effective consequences when their child does something incorrectly. A lot of the times as parents, we overuse punishment to change behaviors, and this isn't effective most of the time. So if these areas are problematic, the walking the middle path skills help by reducing family conflict by teaching validation, behavior change principles, and dialectical thinking and acting. So to recap, the 5 sets of skills in DBT include core mindfulness, emotion regulation, distress tolerance, interpersonal effectiveness, and walking the middle path. When learning these skills in DBT, there are 8 core assumptions, and those assumptions apply to the kids, parents, and those teaching the DBT principles. These include 1. Everyone is doing the best that they can. 2. Everyone wants to improve. 3. Everyone needs to do better, try harder, and be more motivated to change. 4. People may not have caused all of their own problems, and they have to solve them anyways. 5. The lives of emotionally distressed kids and their families are painful as they are currently being lived. 6. Kids and families must learn to practice new behaviors in all the different situations in their lives. This includes at home, school, and work environments. 7. There's no absolute truth. We believe that both kids and parents have valid points to make, and neither are absolutely right or wrong. Truth can be found in either position. And number 8, kids and families cannot fail at DBT. So if DBT is a form of therapy that you feel like would be beneficial for you and your child to know more about, make sure to hit that subscribe button, as many of our future videos will be focused on the skills and concepts that are frequently taught in DBT. If you have any topics that you'd like to hear more about, put your ideas in the comments section. Otherwise, head on over to the next video to find out more ways that you can help your child live their best life.